Have you ever felt completely wiped out even after a full night's sleep? Or noticed your heart racing just from climbing a flight of stairs? These could be easy to dismiss day-to-day annoyances, but in many cases they are your body quietly signaling that it is running low on iron. Iron deficiency is the single most common nutritional shortfall on the planet, and what makes it tricky is that it rarely announces itself loudly. Instead, it leaves a trail of subtle clues on your skin, your nails, your tongue, and even in your food cravings. In this video, I'm going to walk you through 14 signs that your iron levels might be low so you can recognize them early. Because picking up on these in time genuinely can be life-changing and sometimes even life-saving. Let's get into it. Before we get to the signs, here is a 40-second biology bite. I promise it makes everything else click. Your red blood cells are packed with a protein called hemoglobin. Hemoglobin's entire job is to grab oxygen in your lungs and deliver it to every tissue in your body. And right at the core of each hemoglobin molecule sits an iron atom. That is the actual docking point for oxygen. So when your iron stores run low, your body produces fewer, smaller, paler red blood cells. That means less oxygen reaching your muscles, your brain, your skin, basically everywhere. That single chain reaction is behind almost everything we are about to cover. Sign 1. Unusual paleness. The medical term is pallor, and it simply means your skin or inner membranes look noticeably paler than they should. Here is a quick self-check anyone can do, regardless of their skin tone. Gently pull down your lower eyelid and look at the inner surface, the part closest to your lashes. It should be a rich, vivid red or pink. If it looks pale, washed out, or even white, that is worth taking seriously. You can also check the creases of your open palm. In someone with healthy iron levels, those lines tend to be darker than the surrounding skin. If they look faint or similar in color to the rest of the palm, that can point to anemia, though this test is less reliable if you have a darker complexion. Seriously. Sign 2. Constant tiredness and breathlessness. This is probably the most common complaint. A heavy, dragging fatigue that does not lift no matter how much rest you get. And it makes complete sense. If your blood cannot carry enough oxygen, every cell in your body is essentially running on less fuel. You might notice you get out of breath doing things that never used to bother you. A short walk, carrying shopping, going upstairs. Some people feel their heart beating unusually fast or forcefully as the body tries to compensate by pumping blood around more quickly. Sign 3. Spoon-shaped nails. Take a look at your nails from the side. Healthy nails have a gentle upward curve. In iron deficiency, the nail can gradually flatten or even curve inward, like the inside of a spoon. The clinical name for this is koilonychia. You can try a simple test at home. Place a small drop of water on the middle of your nail. On a normal nail, the water rolls straight off. If the drop sits there and stays pooled in the center, the nail has taken on that concave shape. This tends to show up in more prolonged or severe iron deficiency rather than early on, so if you spot it, it is definitely time to get a blood test. Sign 4. PICA, craving non-food items. This one surprises people every time. PICA is a medically recognized condition where you develop strong urges to consume things that are not food, and it has a well-established link to iron deficiency. The most common example is pagophagia, an almost compulsive need to chew ice. Not just enjoying a cold drink, genuinely craving to crunch through cup after cup of ice. Research suggests this may temporarily improve mental alertness in people with low iron, which could explain why the craving feels so strong and satisfying. Other cravings people report include raw pasta, chalk, clay, cornstarch, or even dirt. If you have developed an unusual urge to eat or chew something that is not a food, it is a very specific red flag for checking your iron levels. Sign 5. Smooth or sore tongue. Your tongue is normally covered in tiny bumps called papillae, which help with texture detection and taste. These cells turn over very rapidly. They are constantly being worn away and replaced. When iron is low, that replacement process slows down, and the papillae gradually disappear. The result is a tongue that looks unusually smooth and almost polished. Many people also describe a persistent burning sensation, or notice that food has started tasting different or blander than it used to. If your tongue looks and feels like this, it is often one of the earlier nutritional signs to appear. Sign 6. Cracked corners of the mouth. The corners of your mouth sit at a unique junction, where the moist lining inside your mouth meets the drier skin of your face. That tissue needs to be thin, flexible, and resilient because it stretches with every smile and every bite. Without adequate iron, your body struggles to repair that area fast enough. The tissue weakens, develops tiny cracks, and can become inflamed or even infected. This condition is called angular cheilitis, and while it has several causes, iron deficiency is one of the most common underlying ones. Sign 7. Pink urine. After eating beetroot. This one is genuinely fascinating. Beetroot gets its deep red color from a pigment called betanin. In most people with healthy iron levels, betanin gets broken down during digestion and never reaches the urine. Studies suggest this happens in only around 10 to 14% of healthy individuals. But when iron is deficient, that breakdown process is less efficient, and more of the pigment passes through the body unchanged, turning urine pink or red after eating beetroot. This effect, called beeturia, has been observed in roughly 80% of iron-deficient individuals in some studies. It is not a replacement for a blood test, but it is a genuinely interesting clue. And of course, if your urine turns red and you have not eaten beetroot, always get that checked promptly. Sign 8. Increased susceptibility to infections. Your immune system relies on iron to do its job properly. Immune cells need iron to produce the reactive molecules that neutralize fungi and bacteria. When iron is low, those defenses are weakened. One result can be an increased susceptibility to fungal infections like ringworm, a rash caused by microscopic fungi called dermatophytes, not actual worms despite the name. The same organisms cause athlete's foot, and they tend to take hold more easily when your immune response is compromised. Bacterial skin and chest infections can also become more frequent. Sign 9. Restless Leg Syndrome. Restless Leg Syndrome, or RLS, is that uncomfortable, irresistible urge to move your legs, usually worst at night when you are trying to sleep. It is more common than many people realize, and iron deficiency is one of its most well-established triggers. Here is the important nuance. Your iron levels do not have to be dramatically low to cause this. Iron is regulated differently inside the brain than in the rest of the body. Research shows that people with low normal iron stores, levels that would not even raise a flag on a standard blood test, can still have iron deficiency within the brain that drives RLS symptoms. Studies indicate that up to 60% of people with RLS see significant improvement after iron supplementation. If restless legs are disrupting your sleep, it is worth asking your doctor specifically about your ferritin level, even if it falls in the so-called normal range. Sign 10. Low mood and depression. This connection is underappreciated and really important. When someone presents with depression or persistent low mood, iron deficiency is something worth ruling out, not just assuming it is purely psychological. The reason: your brain uses iron as a building block for dopamine and serotonin, two neurotransmitters that regulate how you feel, how motivated you are, and how well you focus. Without enough iron, production of these chemicals can drop. It is not just about red blood cells and oxygen. Iron is something your brain needs every single day to help you feel like yourself. Sign 11. Hair thinning. Hair follicles are among the most rapidly dividing cells in the entire body. They need a constant supply of nutrients, including iron, to stay in the active growth phase. When iron is depleted, follicles can shift prematurely into a resting phase, and hair starts shedding more than it should. This tends to be one of the earlier and more subtle signs. If you have noticed more hair than usual on your brush or in the shower drain, and you cannot point to another obvious cause, iron levels are worth checking. Sign 12. Chronic itchiness. Iron deficiency can alter nerve sensitivity in the skin and lead to dryness, which together can trigger persistent itching, sometimes without any visible rash or skin change at all. This is an under-recognized symptom that people often chase for months without finding the cause. If you have unexplained chronic itch, add iron deficiency to your mental checklist. Sign 13. Dark circles under the eyes. As the skin becomes paler due to lower hemoglobin levels, the network of small blood vessels running beneath the delicate skin under your eyes becomes more visible. The result is darker-looking under-eye circles, that are not explained by tiredness alone. Many people find these improve noticeably once their iron levels are corrected. As the skin becomes paler due to lower hemoglobin levels, the network of small blood vessels running beneath the delicate skin under your eyes becomes more visible. The result is darker-looking under-eye circles that are not explained by tiredness alone. Many people find these improve noticeably once their iron levels are corrected. Sign 14. Elevated risk of stroke. This is the most serious entry on the list, and it is also the least intuitive. When the body detects iron deficiency anemia, one of its compensatory responses is to ramp up platelet production. Platelets are the tiny blood cells involved in clotting. In some cases, this leads to thrombocytosis, an abnormally high platelet count, which makes the blood more prone to forming clots in places it should not. There have been documented cases of young adults, particularly women, experiencing unexplained strokes where severe iron deficiency and elevated platelet counts were the only identifiable risk factors. This is rare, but it is one more reason why iron deficiency should never be left unaddressed. How iron deficiency is diagnosed. The good news: diagnosing iron deficiency is straightforward and requires only a simple blood test. The best starting point is a ferritin test. Ferritin is a protein that stores iron in your body, and measuring it tells us how much iron you have in reserve, even before anemia has fully developed. A low ferritin result is a strong early indicator. One important caveat: ferritin can appear elevated during inflammation, infection, or in some cancers, so a normal or high result does not always rule out iron deficiency. In those situations, doctors often order a full iron panel, which gives a more detailed picture of how iron is being stored and transported in your blood. Crucially, when iron deficiency is confirmed, the next question has to be why. The three main causes are increased demand, most commonly during pregnancy, reduced intake or absorption, poor diet, vegetarian or vegan eating patterns, or conditions like celiac disease, Crohn's disease, or prior gastric bypass surgery, blood loss, heavy periods, post-surgical, or most concerningly, undetected internal bleeding such as from a bowel tumor. That last category is why iron deficiency in someone with no obvious dietary explanation can be a trigger to investigate for colon cancer. It is a real diagnostic pathway that catches cases that would otherwise be missed. How to boost iron absorption. If you have been diagnosed with iron deficiency, or you want to be proactive, here are evidence-backed ways to maximize how much iron your body actually absorbs. Take vitamin C alongside iron-rich foods or supplements. It can more than double absorption. Think citrus fruits, tomatoes, or bell peppers with your meal. Space your calcium intake away from iron. Calcium competes with iron for absorption, so avoid dairy or calcium supplements at the same meal. Avoid tea and coffee around iron-rich meals. The tannins and polyphenols in both drinks bind iron and reduce how much gets absorbed. Leave at least an hour's gap either side. Animal-based iron, heme iron from meat and fish, is absorbed 2 to 3 times more efficiently than plant-based iron. This does not mean you cannot get enough from plants, but it does mean plant-based eaters need to be more intentional. Take vitamin C alongside iron-rich foods or supplements. It can more than double absorption. Think citrus fruits, tomatoes, or bell peppers with your meal. Space your calcium intake away from iron. Calcium competes with iron for absorption, so avoid dairy or calcium supplements at the same meal. Avoid tea and coffee around iron-rich meals. The tannins and polyphenols in both drinks bind iron and reduce how much gets absorbed. Leave at least an hour's gap either side. Animal-based iron, heme iron from meat and fish, is absorbed 2 to 3 times more efficiently than plant-based iron. This does not mean you cannot get enough from plants, but it does mean plant-based eaters need to be more intentional. If you cook with a cast iron pan, small amounts of iron leach into food during cooking. A genuinely helpful bonus, especially for acidic foods like tomato sauce. If supplements alone are not working, or if absorption is impaired, your doctor may recommend intravenous iron, which bypasses the gut entirely and replenishes stores quickly.